Hi, I'm Dr. Simon Moore.
And I'm Dr. Paul Dillon from the review course in Family Medicine.
We're on our way to Edmonton for the first ever Edmonton review course in Family Medicine. And we were just chatting about the top 6 questions that people ask us about the CCFP exam at lunch at the review course, at breaks at the review course. So why don't we run those down?
So the first thing is, we just went to Starbucks. Is that a large? Is that a medium? Is that small? Is it venti? Is it grande? What size is your coffee?
Yeah, I don't even know. I don't know the brand names. I don't know the generic names. But the thing is, the CCFP exam is exactly the same. You don't need to know the generic names. You don't need to know the brand names. Either or is just okay according to the CFPC's SAM's instructions to the candidate.
Interesting. So what's the next question people ask? People ask about TLAs, or 3-letter acronyms. Can you use them on the exam?
Sure, absolutely. So the instructions to candidate says, don't use acronyms unless they're well known to physicians across the country. So if you use MI, most doctors know that's a myocardial infarction. That one's just okay to use on the exam.
Amazing. And so we actually emailed some of those other questions that people ask us about. We emailed the CFPC exam office and we asked them, what about doses? Do you need to know doses on the exam? And they said,
They told us we can't divulge that information. So not a really helpful answer. The fourth thing that you emailed them and you asked them, what about if there's ABCs? Do we write airway, breathing, circulation, one answer per line? Do we write all those on the same line? What did they tell you?
The answer was one answer per line.
So make sure that you write one answer per line because everything after the first correct answer gets marked wrong. Number 5, what about spelling? Spelling on the CCFP exam doesn't matter. So you went to Starbucks, you said, my name is Lasix.
I said, my name is Lasix. So you can spell Lasix with a C on the exam. It doesn't matter as long as the exam markers understand what you mean.
And the last question we asked, what about guidelines? There's lots of guidelines. There's conflicting guidelines. And in the frequently asked questions on the CCFP exam's information page, it says, answer according to the best practice of medicine at the time of the examination. So in other words, just write the right answer.
Yeah, as Dr. Mike Curlew says, keep it Canadian, keep it current, and that's it.
Those are the guidelines you want to study, absolutely. So I'm Dr. Simon Moore.
And I'm Dr. Paul Dillon from the review course in Family Medicine.